Okay, my name is Chelsea. I'm going to start an IV today. The first step, you would be out of the patient's room. You would check the orders, and you would gather all of your supplies and prep it outside of the patient's room. First thing you would get is your 10 milliliter syringe, and you would fill it with 3 milliliters of normal saline. Taking your disinfectant wipe, you would disinfect the top and withdraw your air. And after you do that, I would remove the needle and dispose of it in a proper sharps container. Then I would gather this and I would connect, and I'm going to flush any air out until you see a drip. And then now I'm ready to go into my patient's room. I would gather my supplies. I would explain to the patient the reason for the procedure, as well as assess for any allergies. I would wash my hands and assess for the appropriate area. You would want to use it on the non-dominant arm as well as not near a joint, or if the patient had something like a mastectomy, you would want to use it on the opposite arm. So I would find the area that I'm going to use. I would wash my hands and apply my gloves. I would check and make sure that there's a pulse, and then I would apply my tourniquet 4 to 6 inches above the IV site. Then I would palpate for the vein that I'm going to use, and grabbing another alcohol swab, and alcohol the area off, making sure not to touch the site again. Then I would take my IV needle and withdrawing from pulling opposite, I would go at a 15-degree angle, bevel side up, and pull it taut. Insert my needle and watch for a flashback. Then I would pull the catheter in as well as withdrawing the needle. Then I would hold pressure as I withdraw the needle. Set the needle aside. Grab this. And twist it on. Then I would make sure that this is unclamped and aspirate and check for blood return. There is blood. So now, using the push stop method, I would flush the IV. Then I would go ahead and clamp the area. Withdraw this. Then I would apply my Tegaderm with the hub of the needle covering the entire hub. And I would, using the little sticky, I would date, time, and initial the IV insertion site as well as the gauge of the needle. Then I would take some extra tape and I would tape off the remainder of the IV to keep it from moving. Finally, I would assess the patient's comfort level as well as check for any irritation. I would give them instructions to call me if there's any irritation or anything that they notice. I would remove my gloves and dispose of those and go chart the location, the date and time that I inserted the needle as well as the gauge, the instructions that I gave the patient, and if any irritation was noted, as well as how many times it took to stick the patient and how they tolerated it.